deficit and get to surplus more quickly.
Question number 4, Grant Robertson.
Thank you, Mr Speaker. My question is to the Minister of Health. Will he approve changes to hospital and primary health services that do not enjoy community and clinical support?
The Honourable Tony Ryle.
Mr Speaker, virtually all changes to hospital and primary health services are made at a local level by DHBs, PHOs and contracted providers within the increased funding of $1.5 billion the government's made available over the last 3 years. For a small number of significant changes proposed by District Health Boards, ministerial approval may be required, and on these few occasions where ministerial approval is required, I do take very serious account of clinical and community support.
Supplementary question.
Grant Robertson.
Why is he saying that he will not approve changes to Hawera Hospital that do not enjoy community support, but he was happy to approve the closure of Taihape Hospital that the community strongly oppose?
The Honourable Tony Ryle.
Mr Speaker, I think the member would appreciate that in those cases they're two quite different situations, and certainly at Taihape there are quite a range of services that are improving in that community as a result of the changes.
Grant Robertson.
Question. Given that he does not want to approve changes that do not have community support, will he step in to ensure that Rangiora people have access to after-hours GP services in their town, which have been cut despite strong community opposition, including a petition of 8,000 people?
The Honourable Tony Ryle.
I have been to Rangiora and had an opportunity to speak with local people about those issues. As the member will well know, the decision to withdraw from after-hours services was made by the local GPs themselves under a system set up by Labor. However, I can assure the House that we're well aware of that issue in Canterbury, and the DHB is now working with the community to ensure a local solution. We have increased Canterbury District Health Board funding by $143 million over the last 3 years.
Grant Robertson.
Speaker. Will he approve the cutting of nurses from frontline service roles in the emergency department of Wanganui Hospital as proposed by the Wanganui DHB and described by the nurses organisation as a danger to patients, given that he does not want to approve changes that do not have clinical support?
The Honourable Tony Ryle.
Mr Speaker, what I am aware when it comes to the Whanganui District Health Board, they have more nurses employed there than where the government began, and it's their responsibility to see how they manage their resources. What we do know in Whanganui is that their funding has increased by about $24 million over the last 3 years, and their increased nurses are part of the extra 500 doctors and 1,000 extra nurses now employed in our public health service.
Point of order, the Honourable Trevor Mallard.
Mr Speaker, I think last week you provided some useful interpretation with regard one of the responses from the Minister of Education, and said an answer which we couldn't understand. The answer was clearly yes. I wonder either could you provide similar interpretation for that response or ask the Minister to indicate whether or not he would approve such a change?
Well, forgive me, it seemed to me the Minister's answer indicated there was a local matter, but I may be wrong there, and if I'm wrong, I'd certainly ask the Minister to correct that misapprehension. The Minister indicates that is. Grant Robertson, supplementary question.
Will he approve the closure of Lakes District Hospital in Queenstown in whole or in part that has been the subject of significant community and clinical opposition, given his statement that he does not want to approve changes that do not have community support?
The Honourable Tony Ryle.
Mr Speaker, there certainly has been a lot of uncertainty around Lakes District Health Board over some years, and there's a special National Health Board panel including clinicians, that's leading a process of working through with the Queenstown community to accelerate healthcare improvements in that area. Its decisions will be made by the Southern District Health Board, and we have increased Southern's funding by $71 million over 3 years.
Question number 5, Jonathan Young.
Thank you.